Okay, thank you, Christy. Welcome, everyone. This is Kathy Nickham. I'm the Education Director for the DPC Ed Center, and I welcome all of you to our session today. We're very glad that you're able to join us. Just a couple of quick housekeeping things. All of your phones are muted. To unmute your phone, #6. To mute your phone, *6. You can put questions in the chat box or wait until the end and ask questions. This session will be recorded, and the recording and slides will be available for all of you. So at this point, I'd like to just do a brief intro to say that I'm very pleased that today's webinar is in partnership with the American Psychological Association. We thank them and have been fortunate to work with them over the last few years, and we appreciate their support, their involvement with the Ed Center. They contribute to every issue of our patient newsletter and to our educational webinars each May during Mental Health Awareness Month. And today, they are sharing with us one of their valuable speakers, and we have Dr. Jody Jones, who will be presenting today on the topic of the emotional ride of the transplant process. Dr. Jones is a licensed clinical psychologist for the Organ and Transplant Center at the University of Iowa Transplant Center, and she's very passionate about what she does and has deep respect for all of the people who are going through the transplant process. Dr. Jones, I'll turn the program over to you at this point.
Thank you. Can you hear me? I hope so.
Yes.
Okay, good. So yes, I wanted to talk today about the emotional experience of going through a transplant process. I know many of the people listening may have already been considered for transplant and might be on a list, and some others might be considering doing this. And so what I wanted to do was kind of broadly discuss what it's like to go through an evaluation and then the experience of actually waiting for a transplant. I have been working in the transplant field for close to 20 years now. So I have seen and done an awful lot of things. I've worked at 3 different transplant centers and can say that we in general do things in a very similar manner, although it's not exactly the same everywhere. What I wanted to talk about today include maybe some of the fears that people experience about going through this process, what to do about managing your expectations, and trying to prepare yourself for the actual transplant surgery. The thing I want to remind you guys of, and I'm sure you've probably heard this before, it's a marathon, not a sprint. And so what this means is that you really do have to pace yourself as you go through the process. You will probably experience a lot of emotional highs and lows as you get pretty excited about certain things happening, and then it gets all quiet and you're not sure what's going on with your status. Just remember, it's going to take a while for everything to happen. So one of the fears that I often do hear expressed by patients is what to expect about the transplant evaluation and then what will happen after you get on the list. It does seem pretty mysterious when you start receiving letters about all the people you're going to meet or the kinds of tests you're going to have done. What I wanted to do was be able to give you an overview of what this experience is like. I think that people who have a better understanding of what they're getting into usually have a little less anxiety about doing it. So the thing that you need to take away from this is to remember that transplant centers are in the business of doing transplants. Although you come in possibly quite nervous that you will not be accepted for a transplant, you need to remember that we are trying to work with you. Sometimes there are issues that come up that keep us from being able to put you immediately on the list or maybe on the list at all. But for the most part, we're going to do everything we can to help you get there. That's what we want, is to see you transplanted and resuming what feels to you like a more normal life. The best thing that you can do in this situation is to be honest with the team. You will be asked a lot of questions about all parts of your life. This is different than a lot of medical procedures you might go through where you wouldn't necessarily be telling us about your family or your work or what kind of financial support you have. This is a very different experience because it's a much bigger commitment. But what we need to know is the honest truth about what's going on in your life so that if there is a problem, we can talk to you about how to solve it. And the thing I have to say is I totally understand if you're scared, you're nervous that something you might reveal might keep you from being a good candidate. But the truth is that usually these things do ultimately come out. So if you're trying to hide something, it's just going to make you look like you're trying to hide something. We understand your reasons for wanting to do that, but it's really, really important to be as open and honest as you can be. So the waiting actually starts when you get referred to the transplant center, and this happens through a variety of ways. Sometimes your dialysis center may make the referral. Sometimes it's your kidney doctor, or could even sometimes just be your primary care physician. What happens is that the information that comes into the transplant center has to be processed to make sure that you have insurance company that allows you to be treated at that particular center. This is important. I know it's hard to think about somehow not being able to get transplanted because of a money issue or insurance, but we have sometimes seen people start transplant evaluations in one place and then their insurance changes and they're no longer allowed to be seen there and they have to start all over again. So, we do what we can up front just to make sure that once you start the process, you'll be able to finish it at the center of your choosing. Once we get all of that squared away, a scheduler will call to set up your first appointments. This can take a while, and every transplant center is different. So for the most part, all of us, we are trying to get new patients in as soon as we possibly can. And some places you can get in maybe just a few days, but sometimes it can take up to a couple of months before your evaluation starts. Patients are usually sent information about the evaluation as soon as the appointments are set up. And we want you to read that information because it will include really important facts about how to prepare for your day or days of being at the hospital. So for instance, you will oftentimes be provided information about local places to stay because we do understand that not everyone lives very close to a transplant center, so you might be coming in from out of town and have to spend the night. Most transplant centers, if they don't have their own sort of what we call a home away from home, they have deals set up with local hotels so that you can stay there for a reduced fee. Very important, we do include instructions for tests because some of the tests that you'll have run require that you not eat or drink for a while, and that's really, really important. So you need to review that when you first get the information and then definitely look at it again a few days before the evaluation starts and make sure you check it yet again, even just, a day or two before you come, just to make sure you're clear on if you can or cannot have breakfast that day, if you're allowed to take your medications that morning, that sort of thing. And then we also provide information about who and what to bring to your evaluation. Most programs do want you to have at least one caregiver, and what that means is someone who would be able to assist you through the transplant process. This can include spouses, children or parents, close friends. We don't really care as long as it's someone who's devoted to you. You might also be asked to bring other things like medical records, your insurance cards. We do our best to have your outside providers fax us information before you come. So I think less and less often people are expected to bring their own information. Now, the evaluation itself can take many different forms. Some centers try to do all the testing and appointments in one day. For instance, we do that here at University of Iowa, partly because we're trying to work around people's dialysis schedules. And so, for instance, if someone does a Monday, Wednesday, Friday dialysis, then we will bring them in on a Tuesday. And for people on the opposite days, we'll bring them in on a Wednesday, for instance. Some centers do multi-day evaluations, and they'll make arrangements for you to have dialysis while you're there. There's no one right or wrong way to do it. The schedules are affected by a number of different things, including how many people are being evaluated at any one time. Some transplant centers have like 2 days a week where they're evaluating people. Others will do it every day of the week. There's a lot of coordination with the scheduling, and so that sometimes dictates why it takes a little bit longer for you to get in, is we have to have all of our team members here and have slots available for you to see everyone you need to see. Now, a little bit more about caregivers that I had just mentioned. In general, people do want you to bring someone with you, and we know this can be a real inconvenience for your partner, whether it is a friend or family member. But it really is a good idea to have this person there for a number of reasons. One important one is that you just have an extra set of eyes and ears to help you remember everything. I promise you, you are going to be given a ton of information by everyone you meet. So it's nice if you have that other person there who is hearing the same things, who may even ask questions that you wouldn't think to ask. If your caregiver brings a notebook where they can actually take notes and that sort of thing, that can be very helpful. I've also met people who just went ahead and recorded all of the meetings and appointments on their phone so they could go back and listen later. That might be a little bit tedious, and I don't know that you have to go quite that far, but it is helpful to have just the extra notes to remember everything later. One thing that's really important, the social workers typically want to confirm with the person who is your caregiver that they would be able to help you before and after the surgery. We usually have a list of expectations that we are able to provide so they understand very specifically, does this mean providing transportation? Yes, that does in some cases. Some people will be actually helping with change your dressings, and doing other more medical-oriented type things. Some people will just be helping you organize your pills and that sort of thing. Sometimes your caregiver also can help provide information just about your medical history that you may not have recalled exactly, and so it's nice to have somebody there who really knows you and knows your situation. Some of the health information that is helpful for you to have with you, of course, is a list of your medications, so that we can update in our system all of the medicines that you're taking, no matter who prescribes them. We also need to know what kind of previous surgeries you've had. Believe me, the surgeon is very interested in knowing about this because they need to know what kind of scar tissue they might need to cut through, or if there's something unusual about your anatomy that's going to affect how the transplant might go. We also need information about any other health conditions that you have so that we know how long you've been dealing with certain issues, what kind of treatments you've been through, the kind of medicines you might have been on. If you have a previous history of cancer, for instance, we would want to know what the findings were, and did you have chemo or radiation and that sort of thing. So this is another place where caregivers can be very helpful, because if you can somehow summarize all of your information and put it like in a notebook, you can just carry that with you. And so if anyone has questions about the dates that certain things happened, or if they actually want to see the notes, you've got them right there with you. So now on the day or days of the evaluation, you will definitely be meeting several members of the team. And different programs handle this differently, but in general, you will meet a surgeon. And this will involve being touched. This is a medical exam. They're going to be feeling your abdomen and trying to get a sense of, what's going on with you health-wise. and usually the nephrologist, who is the transplant kidney doctor, will also be doing something similar. So just be aware that some of these appointments will involve something like a medical evaluation where you will be touched. For anyone who's uncomfortable having someone put hands on you, just say so up front and let them know just to ask before they, put their hands on your tummy or whatever. Everyone meets with a social worker, and this is just because we need to know what your social circumstances are. Do you live alone? Do you have people with you? What kind of transportation do you have? They frequently will go ahead and ask you also about mental health issues. And by the way, I just want to say it's normal for people to have, lots of mixed feelings about going through this, and so it's completely normal if you have had, issues with depression or anxiety. A financial counselor is going to talk to you about what kind of insurance coverage you have. They will be able to make really good predictions about what kind of copays you might have for your medications and that sort of thing afterwards. So they're able to really do a good job of mapping that out for you. The pharmacist will talk to you about the medicines that you're on now. Probably will talk to you about how do you manage those medicines in terms of how you organize, and do you use alarms to remember, that sort of thing. They'll also talk to you some about what kind of medicines you would be on after a transplant. Frequently people will also meet with a dietitian, and that's just to make sure that you're following your renal diet or any other special considerations you might have if you're diabetic. I'm a psychologist. Not every program has a psychologist or psychiatrist associated with the program. I do meet a lot of people, not necessarily every person that walks through our doors, but for anyone who has had a reported history of maybe some mental health issues, just like depression, anxiety. When I say mental health issues, it sounds a little extreme, but most of us have gone through periods of depression or anxiety in the past. And so if there are things that we need to talk about with that, it's not a huge deal. I'll talk to you a little bit about your coping and, again, your lifestyle habits and things like that. In addition to meeting the team members, you will also undergo tests to make sure, for instance, that your heart and lungs are in good shape. To get you through a transplant surgery, you'd be under anesthesia for quite a while, and so we need to make sure that you're going to be okay, your heart's going to be fine, your lungs will help you keep breathing, and some of the scans are just to see what kind of shape your kidneys are in right now. You will have labs drawn when you're here, so you just need to know that. They do take kind of a lot of blood. I know some people are squeamish about needles. You guys are doing dialysis, so you've gotten used to it, hopefully. We are looking just for the kinds of information that tells us how your overall health is and how your kidneys are doing. It will give us a bit of a hint of how compliant you are with dialysis, so we will be looking, for instance, at your potassium and phosphorus levels. And many centers will perform a toxicology screen. For instance, marijuana is legal in some states and not in others. Some people don't make a big deal out of it, others do. Most places would be concerned, I think, if they found other more serious types of substances in your system, cocaine or meth or something like that. But just be aware that there is some possibility that there may be a toxicology screen performed. I can tell you here at University of Iowa, we actually do not look for things like that, but not every state handles that the same way. Part of the reason that we need for you to have an updated medication list with you is so if we see something in your lab work that looks like it doesn't belong there, we can confirm that you have or have not been prescribed a certain medication that might produce a positive result. You will be assigned a nurse coordinator when you go through your evaluation. This is somebody who's sort of like an air traffic controller who's sitting up high and can see all the planes coming in and out. Your nurse coordinator is managing your situation in terms of handling all of the test results or notes that we get maybe from outside providers, your doctors, your dialysis centers, that kind of thing. This person also will collect all of the information that we gather during your evaluation and is the person that you should get in touch with anytime you have a question about what your status is. He or she will know where you stand in terms of are you on the list or not, or what are we waiting on still, that kind of thing. We want you to have this person as your contact person. We want you to always have that one person that you know that you can get in touch with on the team that belongs sort of to you and you belong to him or her. And so this is the person that will let you know officially when you are on the list. If anything changes about your situation, you need to let the coordinator know, and so that would mean something as simple as a change in your phone number, but also, of course, any moves that you're making, change of address. If you end up hospitalized at an outside hospital for some reason, definitely we want to know if you lose insurance, because we can still help you try to rearrange things, but we need to know these things in advance. The team will meet after you have been seen here by everyone. So do know that we all sit around a table and talk. We look at all of your test results and then we talk about the conversations that we had with you. So we do all get together at one time and discuss these things. For the most part, everyone who has met you is in that meeting. Sometimes they can't be, but they do provide their notes and information and feedback. Everyone on the team has input about whether you are ready to put on the list or not. There's not one single person who makes the final decision about yes or no. So even, you know, you might feel a little disappointed if you're not immediately put on the list, but it's not one person that's holding you up. Please know that. We make decisions as a team, and everyone agrees when maybe more things need to get done before we can get you on the list. What the team needs and what we're looking for is to, as I mentioned earlier, know that, you know, your body is basically healthy enough to get you through the surgery, to make sure that any other health problems you have are being managed properly, to know that you do have all the social support that you need, and that means people that will help you when you're at home after the surgery, people who can drive you, people who can help you with your family. For some folks who need a transplant, they may still have, you know, kids in elementary school who can't drive, that kind of thing. So we're going to be asking you, you know, not only do you have the care that you need, but does everyone in your life that you normally help take care of, do they have the care they need? We also need to make sure that your insurance and your finances are squared away, just to make sure that you've got the money that you would need to pay for your medicines after the transplant. We will be looking to see if emotionally and psychologically you're ready for this. And we're not looking for perfection here. As I've said a few times already, it's pretty normal for people to go through periods of depression and anxiety when you're dealing with a chronic health issue. If you're on dialysis, it can be stressful. And so we are not surprised when we hear people talk about having those types of feelings. Please don't feel that you need to hide any of that from us. Beyond just depression and anxiety, which are fairly common experiences, sometimes people have more serious issues going on with them, like PTSD, bipolar disorder, or even schizophrenia. PTSD, by the way, is post-traumatic stress disorder, and although you often hear that referred to in terms of people in the military, a lot of people have been through traumatic experiences and may have had those kinds of psychological reactions afterwards. Bipolar disorder is where people have pretty strong mood swings. They go from depression to what's called mania. And people with schizophrenia sometimes have some problems with, you know, maybe hallucinations at times, having a real struggle with depression or mood swings too. Sometimes bipolar and schizophrenia look a lot alike, in fact. Here, as the psychologist, I'm the person that will talk to a person who has one of those issues. We talk to you about how you're managing your symptoms and what you're doing for treatment. We want to know what kind of psychotropic medications you might be taking and whether you see someone for therapy. And then we also want to know that you have just people in your life that support and help you. We don't have a big problem with people who are dealing with psychological or psychiatric issues, but it really, really helps when you're getting all the treatment that you need and you have people in your life who are very supportive of that and who don't try to undermine you, but instead will do what they can to help make your life stable and secure. So in most cases, people are not put on the waiting list immediately. They go into this place that we call a deferral category. It's basically like being put on hold for listing. And so this is another aspect of the waiting process that can feel a little frustrating because now you've been through the big deal of the evaluation. You're very hopeful about hearing back from the transplant team, and then they may tell you, oh, well, we're going to have to wait 3 to 6 months while you take care of some things. This is actually quite normal. This is more normal than not. There are people that just need more testing or more time to get things taken care of. Some of the reasons that we do this is so that you can take care of just what we call health maintenance issues. So a woman may need to go for her annual gynecology appointment or have a mammogram. People over 50 might need to get a colonoscopy. Usually, people do need to get some vaccinations taken care of. So there's just kind of housekeeping things that need to get taken care of. There are sometimes people that have some financial issues that they need just a little time to work out. Sometimes people need to identify a little more support. You may have somebody in your life who emotionally is totally there for you and who maybe even lives with you and does a lot of stuff for you, but who doesn't drive. And so we may ask you to identify somebody who can reliably, take you places, go pick up prescriptions for you, that sort of thing. We may need you to take a little extra time to address any mental health issues. And so, for instance, people who are coming in with maybe untreated depression, or they have been treated for depression, but the medication's not working as well anymore, we may ask you to just go back and see your doctor again and work on that, or start therapy to just talk to somebody, get talk therapy for extra support. And again, sometimes it's really basic stuff. We need everybody to have a primary care physician locally who you can always follow up with in a reliable way. And so sometimes we're just waiting for people to just, get some of that stuff taken care of. During the deferral, technically you are not on the wait list. And I know this can be a little bit confusing for people, but when you're on hold, you are on hold. You are not listed yet. The things that you can do to help make this time pass quickly and make sure that you get everything done is to maybe make a checklist or use the letter that your coordinator sends you. After your evaluation, you should receive a letter from the coordinator that says either you are listed or maybe even you cannot be listed at this time, and they may explain why. And then for the deferral, you will be eligible for listing once you complete these items. And so you can make your own checklist and write those things down, or you can just use that letter as your guide. What you need to do is stay in touch with the coordinator who sent you that letter. So you can check in with him or her and find out, are your test results being sent to the transplant center as requested? You can call and ask questions. I'm not sure what vaccinations exactly you need. My doctor said this, and you're telling me this. So make sure that the communication lines are open there. So as I said, make this checklist if you think that would be helpful, and outline it in any way that you need to so that you can check your things off, make notes, that sort of thing. It is your responsibility to handle these items. So when you're given this letter with the deferral requirements, it's back on you to take care of this stuff. Now, sometimes we will order a certain test for you if that's not something that you can do on your own, but there are some things that you will be asked to do that maybe you've not done before. You may have never needed to call the doctor and ask for a certain number of vaccinations. You can take that letter with you, and when you show up to see your primary care physician, say, these are the things that I need. We will try to give you instructions about how to make these appointments and what to do, so that you're not entirely confused. But again, we want you to call us and let us know if you're struggling in any way, if you just don't understand what it is that you're supposed to do. You actually have control over this, and so while it may seem a little overwhelming, the good thing about this is that during this waiting period, during this deferral, you are actually the one in control of making it happen. So if you've been told, in 3 months we'll put you on the list if we can, get this stuff taken care of, then great. These are things that you can do. This is an okay thing for either you to do, or if you need to ask a family member for help, then do that. But, that's a way of taking control, and that's actually a really good thing. Again, please call us if you feel like you don't understand what you're supposed to do, and make sure that you maybe have another family member who is kind of looking over your shoulder, helping you if you feel like you need any extra assistance. Something to try is to maybe just get a calendar that you keep with your checklist so that you can really keep an idea on when things are happening and make sure that you don't forget when you do set up appointments. You can also write down all of the phone calls that you need to make and look up the numbers, write them down so you don't have to look them back up every single time you need to call that office back, that kind of thing, like for the dentist. And then as each appointment is made, put it on your calendar and circle it so you don't forget. Try not to at least, schedule appointments on your dialysis days. I know sometimes this can be hard because some places only have clinics that run on your dialysis days. If you don't have a choice, talk to somebody at dialysis so that you can reschedule your dialysis time, if at all possible. And then, of course, if you need transportation to your appointments, as early as possible, talk to the people who will be driving you. And then, as you make those arrangements, write down that person's name next to the appointment with all the other information, just so that you stay really clear on who's doing what on which day. You should keep that calendar out all the time just so that you can stay on top of what you're supposed to do and when. And then also so that you can remind anybody who's helping you. You can call them a day or two in advance just to remind them, or ask if there's going to need to be any changes in their plans. Here's just an example I wrote out of what a calendar might look like for you on any random month. This would be a busy couple of weeks, but you see here I went ahead and wrote down for an appointment for a dentist on the 9th with the phone number, the time, and who's driving. On the 12th for a vaccination appointment with the primary care physician, again, phone number, time, and who's driving. And then later that next week, a colonoscopy, where and who would be taking you. So it's just one way of trying to keep straight everything that needs to get done, but it is a good way of making sure that all of your deferral requirements are getting taken care of. I want to remind you that these are just things that you do one step at a time. You're going to climb that ladder one rung at a time. Again, this can all seem pretty overwhelming. You're just going to take it literally one step at a time. And as I said at the beginning, this is a marathon. It's not a sprint. Everything doesn't have to get all done at once, but you just need to hop on it and get going. So sometimes the transplant team will ask you to come back for more appointments at the end of when they've told you your deferral is over, just to make sure that you're ready. That's not always the case. Sometimes once we have all of the test results in and we're all good on everything, the coordinator will just call you and say, yeah, it's all taken care of, and we are going to put you on the list. Once you are listed, the coordinator should be in touch with you to let you know that, and you will be sent an official letter explaining that you are on the list. So please understand, you are not on the list until you see it in black and white. And we will also send you some more information that just comes from kind of the national organizations that manage transplants and oversee all of the transplant centers. They just want you to have all the information you need. If you're having a problem, if you ever needed to file a complaint, anything like that, we want to make sure you have all of your resources available. So now you hurry up and wait. The wait for a kidney can be several years. And what this means is that during this time, you just got to keep going to dialysis and going to your doctor's appointments, just like what you're already doing. It's just more of the same. You always need to make sure that you have reliable transportation, and you also need to make sure that the team can contact you at any time. If something happens with your phone, your battery dies or something like that, please, immediately replace it. Usually, people give the transplant team more than one phone number to contact them by, like that we'll have backup caregivers and things like that, but we really need to be able to get in touch with you personally, so make sure you always have your phone working. Obviously, if you change your phone number, your address, you get divorced, you change dialysis centers, anything that changes in your life, it's a major, minor, even if it doesn't seem that relevant to you, call your coordinator, because we do need to know if there's going to be anything that's different about your life in terms of where we're sending you home afterwards or who's going to be helping you, any of that. Waiting is the hardest part. This is the human condition. Waiting is painful. Think about it just when you've been at the grocery store and you're in a hurry and you're looking at all the different lines and you get in the one that looks the shortest and you're looking over at the other ones that seem like they're moving a little faster, and it's frustrating. Think about the times that you've had to wait for something in the mail or a check to come through. It is very frustrating. Waiting for something as important as a kidney transplant can be maddening. And I have had so many people tell me that once they are transplanted, their biggest relief is that they're not waiting anymore. They don't have to wonder how this is all going to go. The thing I want you to really, really keep in mind is that your life is still meaningful even while you wait. It can feel like, oh, my life will start over again, or things are going to get a lot better after the transplant. What the transplant hopefully will provide is for you to have the ability to pee and not have to go to dialysis anymore. But you're definitely going to be taking medications. If you don't have a good marriage now, your marriage is not going to improve afterwards. If you do have, tight finances, you're still going to be having to manage those tight finances. Transplant can make a major improvement in your quality of life, but it doesn't fix everything. And so while you're waiting and on dialysis, you try to remember that your life is valuable as it is. It is precious. Find ways of trying to discover meaning in your life in the smallest of ways. And I realize that this does sometimes mean really scaling back your expectations. I suggest that everyone try to do something that makes you feel good in some way every single day. And this means paying attention to all the little things that do make you feel good. If it is as simple as getting home from dialysis, sitting down in a chair and kicking off your shoes, appreciate the goodness that you feel in that moment. you know, as spring comes on, I know especially here in Iowa, it was an amazing thing. It finally happened sometime in May. Finally, buds started coming out, seeing the green. Every day I started seeing the beauty and hope in life again. Those are the little things you have to start focusing on, because sometimes there's a whole lot of big things that really don't feel good and don't feel right. Remember, this is one step at a time. And so you need to try to stay in the moment as much as you can. It's just that one rock. Stand on that rock, and then take your next step and the next step. So while you're on the waiting list, there is a whole lot of nothing that is happening in terms of your contact with the transplant team, usually. Now, again, we do want you to contact us if there's any changes going on with you. But the truth is that you are not necessarily going to be getting a lot of phone calls or letters, that sort of thing, from the team. Your coordinator is sometimes tracking hundreds of other patients who are waiting for a transplant, and so it's simply not possible to, for instance, make a weekly phone call, although we would love to do that and just know how everything is going for you. So if you don't hear from someone on the team, please do not feel hurt, and please know we have not forgotten about you. Your name is on our list. It's on the National Register. You are there with everybody else who's waiting. I do not want you to worry about that. We will let you know if something changes about your status. So just, it can be a little bit uncomfortable. Do feel free to call somebody on the team if suddenly you just feel like, I just need to know. I just need to know, am I still on the list? Sometimes, you know, your nerves work on you a little bit, and that's normal too. Usually, at least I know here in this program, we try to bring, or we do bring people in once a year. We want to update all testing, and oftentimes we'll have you go ahead and meet again with most of the members of the team just to make sure everything's going okay. And then there are times when occasionally, like the financial counselor or social worker might be calling you on the phone. If, in fact, you have had to change insurances or anything like that, so they just like to check and make sure that nothing major has happened in your life that would interfere with your ability to move forward with transplant. So, hello, kidney. What happens when you get the call? When you do get that call, the coordinator or whoever is on the phone with you will tell you how soon to get to the hospital and where to check in. The truth is that although we want you to be fairly expedient in getting to the hospital, in truth, it can often be many, 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 many hours before you would potentially be getting transplanted. So do not get hurt trying to get to the hospital. It is, you know, imperative that we get you here safely, so drive safely, and we generally do have enough time for everybody to come in, and especially here at University of Iowa, we've got people that live on the other side of the state, and it can take 4 or 5 hours to get here by car, and that's fine. We will call you as early as we possibly can when we think that we have a kidney available. There are sometimes like false alarms that come up where for some reason the transplant's not going to work out. It may turn out that maybe the kidney ended up not being as good a match as the labs originally implied. It could be that something happens with the donor, and I'm talking about deceased donors. The thing that people don't sometimes understand about deceased donation is that we take organs from people who've suffered like neurological injuries, who have some kind of brain death, or their personalities are gone. They will never be the same again. But their bodies are alive and are being kept alive on machines sometimes. Once in a while, when we think that we're going to be able to do transplants, the person who is being kept alive on machines, the machines aren't enough to keep it going, and we end up losing on that chance to get those organs. And it's a sad situation, but these things do happen. Also, what can happen is you as the potential recipient may show up and just by dumb luck, you may have a rash or a fever or something like that that would keep us from being able to move forward with your transplant because you might be too sick to get safely through it. When you wake up from the surgery, you're definitely going to be sore. But the people who are taking care of you in your hospital room will get you moving as soon as possible, and walking is good for you as long as you have the functional capacity to walk. And so please know that you are going to be encouraged to move maybe before it feels safe, or you may feel a little freaked out. I've had people tell me that they're afraid that where their kidney is sewn in, that like maybe somehow it's going to rip out or fall somehow, and that's totally understandable. That won't happen, but just know that it's normal to be nervous about it, and yet still you need to follow the directions that are being given to you by your nurses and doctors. And we definitely want you to drink water. Although this may seem pretty straightforward, for those of you who've been on dialysis for a long time, you've gotten really, really good at ignoring your thirst and restricting how much fluid you take in. And now it's going to be a total reversal of that, where you're going to be asked to consume a lot of water. And it can be kind of overwhelming. They'll set goals for you, and as much as you've ever at any point felt thirsty and thought, oh, I would give anything if I could just chug a gallon of water, once you're in the situation where you've got to start drinking all this water, it seems like too much sometimes. So we just want you to pace yourself. Use a straw. Drink it through a straw. Maybe it'll go down. We'll make it go down faster. But that's going to be, you're going to hear it over and over again. How much water are you drinking? Are you drinking your water? So yes, drink your water. Your kidneys need water. Sometimes the kidney is a little slow to wake up after the transplant. Sometimes there are people who will need a few dialysis treatments while the kidney is kind of getting up to speed. You shouldn't worry if this happens, because in most cases the kidney will be fine and it'll wake up by itself. Once in a while, unfortunately, yes, it ends up not working out, but you're not really in any worse shape than you were in before. If you were doing dialysis before, you're still doing dialysis. But it will happen in a few situations where someone might just have a few dialysis treatments, or it may go on for a few weeks, and we just slowly wean you off of it, and you're fine. After the transplant, you will be asked to come back on a regular basis for appointments. These are absolute, and so that's why we're always really firm with people about getting transportation. We know that sometimes, like on the day of, if you get the call for a kidney, yeah, you've got people that are like, oh yeah, totally, I'll get you there to the hospital, but we need people that are also committed to bringing you back for scheduled appointments, or if something happens, if we see something in your labs that we want you to come back into the hospital, those can be unexpected trips. Those are not negotiable. We need to have you come back. If you're asked to come back, there's a reason for it. We need to get you here. Do know that you will be on medication for the rest of your life. You're already on medication, so this actually isn't really going to change. But you will be on a very strict schedule. The anti-rejection medicines that you take, we want you to take every 12 hours. This will just be a normal part of your life, and it actually won't take that long for you to get very used to it. But do know you will always be on medicine. And again, not negotiable. You also will need to go to the lab on a regular basis, especially right after the transplant. We have you go at least a couple of times a week because we have to try and get that anti-rejection medicine in the right place. And sometimes those medicines do cause side effects. And we are sorry about that. It can make people kind of shaky or have a hard time sleeping and that sort of thing. We do want to know what kind of side effects you're having, but you can't not take a medicine just because it doesn't make you feel good, okay? You absolutely must take your medicines. And, we'll do our best to work with you if you are having problems, and sometimes we can switch one medicine to another and it'll help, but you can't just not take your medicines if you don't feel good on them. This is going to be a big change for you if you have a transplant. And I know that, it's exciting. It's wonderful. And even for people who get really tired of dialysis and hate the fact that they're giving up so much of their lives to dialysis, they do form special relationships with the people that take care of them. And, after spending a long time in a dialysis center, sometimes you become very close with your nurses and the technicians and sometimes the other people who are there. And it is really important to know you're going to lose that part of your life. You have wonderful new challenges coming up in front of you where you'll have free time, where it's easy to travel and do lots of things you want to do. But we do know that you're going to miss those people that have been such a crucial part of your life. And it's normal to feel sad about that. When you are healthy enough, if you feel like it, you can go back to the dialysis center and say hi. I think it probably would make them feel really good, the nurses and social workers and everybody who works there, to see you come in, and it probably makes the people who are there dialyzing feel hopeful that they might get there too. So, just know it's a big transition. And I have actually known people who have sometimes decided that they're just not going to get a transplant because their life with the dialysis people is too important to them. And that's okay. If that's the most meaningful part of your life, I think that's actually a beautiful thing for you to hang on to that. So I have known people that have chosen not to move forward with transplant because of that. It's a big transition. So again, things I want you to remember: transplant is a lifetime commitment, and you will be responsible for so many parts of your health care. It can become a lot more manageable once you break it down into smaller pieces, all of that one step at a time, one rung at a time. It's a marathon. So just remember that it can be a long wait, but your life is important and meaningful while you are waiting. Live in the moment. Remember that life is happening now. Your life is not on hold. You are important to your family and friends, and you are important to the people who are helping to take care of you. And as I said earlier, try to just identify even just one good thing in your life every single day. Just the joy of seeing sunshine coming in through the blinds. The smell of honeysuckle. I love that smell, so heavy in the air in the summertime. The relief of putting on your favorite pajamas at the end of the day. How good it feels to have a hug. Every day, all of us do, in fact, have things that happen in our lives that make us happy. I want you to also remember to stay connected to people. Stay connected with friends and family and people who look out for you, your neighbors. You might want to consider joining groups on Facebook, especially that provide support for people who are on dialysis or waiting for a transplant, people who understand what you're going through. And then, actually think about how dialysis is for you. Make a point of maybe trying to say hi as you walk in to dialysis if you're not normally somebody who does that, if you're maybe a little more reserved or shy or just feel like you're trudging in because this is your job. A smile goes a very long way and can mean so much to somebody who's not having a good day. It'll make you feel a lot better. These are the things that I think about that make me smile. This is my cat, Finnegan. He's about 11 years old now. This is Shandy. She's a runner. She's always trying to get out of the house, and I'm always trying to chase her down. And this is little Pippa, who is an absolute nightmare of a cat, so it's a great thing that she's so cute. And I tell you what, anytime I think about these little creatures, if I'm having a bad day, thinking about your pets, it seems like such a simple thing, but they just give you unconditional love. It can put a smile on your face, a smile on your heart. So I want you to remember to do something that brings a little joy into your mind and in your heart every day. And that's the end of my presentation. I thank you so much for your patience and for listening to me throughout.
Thank you so much, Dr. Jones. I don't know if we're at about 5 minutes to 3, so if you're able to take a few questions, that would be great. And I do have one lined up on chat, if you wouldn't mind.
Yeah, no, that would be great.
Angela had asked about the emotions. I think you started to briefly touch on the decision to even pursue a transplant. And she had asked about the emotions holding someone back from being 100% on the transplant, like 100% sold on transplantation, like the fear of side effects or the medicine, et cetera. Could you talk a little bit about that, if you wouldn't mind?
Yeah, and did you say something about fight or flight? Did I hear you? I didn't quite catch the very end of what you said.
No, I'm sorry. Hold on. Oh, she was wondering about being, like, the fear of side effects, the emotions that keep you from being 100% on the transplant side, I guess.
Yeah, no, I understand that, because a lot of times when we're talking to people who are considering transplant, we are telling them you're trading one set of problems for another. And to a large degree that's true, although in my mind, usually people are in a situation after transplant where the problems you're managing are a lot simpler to manage. But it is true that the immunosuppression, for instance, that we put people on after a transplant can increase your likelihood of certain cancers, for instance. We really caution people about wearing sunscreen because they're much more likely to develop some type of skin cancer. For anyone who's ever used chewing tobacco, we insist that they absolutely must stop because you're so much more vulnerable to developing a mouth cancer. Steroids, things like that, those can reduce bone density and cause weight gain and that sort of thing. So it's understandable when people are fearful about that. Now, transplant has changed a lot from what I think sometimes people remember from like the 1980s, where people would, especially women, would end up growing hair on their faces and they'd have big round moon faces and gain a lot of weight. In a lot of situations, we're able to take people entirely off of steroids. It's not true for everyone, depending on what your particular disease process is, but we're able to keep people on much less medication now than I think what was used to be standard. And so a lot of those side effects actually do go away. As people get used to the immunosuppression, we're able to lower the levels. There are fewer side effects. People have actually told me that sometimes the side effects are helpful in that if they start getting a headache, it may imply that their immunosuppression is actually getting a little high for some reason, and so that headache tells them, oh, I need to talk to my doctor because I think, there's something that has changed here. So it's totally understandable to be nervous about those things, and talk openly with the transplant team about that. If you, rather than hold yourself back from considering transplant, I would still encourage everybody, go and hear what they have to say at least. And then if you choose not to move forward with transplant, then it's your choice and you're not doing it out of fear. You're making it what you feel is the best decision for yourself. Are there any other questions? Okay, well, I guess we're wrapping up. I thank everybody again. Really appreciate your attention and patience going through all of this. So thank you so much for having me.
Oh, and Dr. Jones, thank you so much for sharing all the information that you did. We certainly appreciate it very much. And I want to thank everyone for being on the call or on the webinar with us today. And just a reminder to everyone, please fill out the feedback form, and we encourage you to join us on June 28th at 2 p.m. Eastern Time for our next webinar on understanding and managing chronic pain. So we will see you then, and please, if you don't get our newsletter, go to our website and take a look at it or download it. You'll find more information about transplants there. And again, Dr. Jones, thank you so much for sharing your time with us today.
Absolutely. Thank you for having me.
Thank you.
Thank you, everyone.
Bye-bye.
Bye-bye.